Bones and I have an incredibly important topic to talk to you about today, and that is Medicaid unwinding. Some of you have already received letters saying that your Medicaid is under review or that your Medicaid has already been dropped. And it can be really scary when you're not sure what the next steps are. We're going to break it down for you, talk to you about next steps. In full disclosure, a lot of what we're going to cover for resources is in the state of Texas, but this also can be applied to you no matter where you live in the United States. So, come on, Bones. Let's do Medicaid unwinding. Now, what exactly is the unwinding? You hear this term and you're really not sure what that means. Because when I think of unwinding, I think of what I want to do on the weekend or after a long day of work. Medicaid unwinding is not that at all. To truly understand what it is, let's take a step back in time and go to 2019. Prior to the pandemic, if you received Medicaid and you needed to continue your coverage, most states required you to renew in person and show you still qualified. When the pandemic hit, a public health emergency was declared by the Trump administration in January of 2020. A public health emergency is a response to an event that impacts the health of the public. These events can be man-made or natural. Some examples of a public health emergency include wildfires, tornadoes, floods, the Ebola virus, and swine flu. In the case of the public health emergency being declared in 2020, it created additional support of pandemic relief efforts such as increased access to telehealth visits, free COVID testing, and vaccines. This time when the public health emergency was declared, we all felt it on a national level. A few months after that, in March of 2020, the Families First Coronavirus Response Act was signed into law, which gave additional funding to federal agencies. This helped provide support for unemployment benefits, paid sick leave, nutrition programs, and so much more. One of the stipulations of this act was to allow Medicaid benefits to automatically continue without having the need to renew them every year. And this was a really big deal. This benefit was scheduled to end when the public health emergency ended. Effectively, it linked them together. However, fast forward, December of 2022, a new sheriff rolled into town called the Consolidated Appropriations Act. This new sheriff stated that the public health emergency and Medicaid continuous enrollment were no longer linked together. Therefore, it ended this beautiful relationship. Breakups are so sad. The result of this decision is that continuous enrollment was set to end in March 31st, 2023. And the public health emergency was now set to end May 11th. Wait, what? Now I know you're probably a little confused and you're trying to figure out exactly what does this mean to you. To put it simply, now that continuous Medicaid enrollment has ended, everyone on Medicaid has got to renew. So what does that mean? There are tons of questions around this, like how do I do this? Where do I go? And what if I don't qualify? And Bones wants to know, how do they renew that many people? That is a valid question. According to the Kaiser Family Foundation, from February of 2020 through October 2022, the total number of people enrolled in Medicaid grew to 91.3 million, an increase of 21.2 million. That's a huge number. The Department of Health and Human Services estimates that 15 million people will be disenrolled from Medicaid and 6.8 million will likely still be eligible. In the state of Texas, Medicaid enrollment grew to 5.9 million, an increase in 2 million people since February of 2020. It's estimated that half of the people in Texas have coverage because of the Medicaid continuous enrollment. So what's the plan? The plan is to unwind in two phases. Phase 1 is to prepare for the renewal process, and Phase 2 ensures that everyone who receives Medicaid takes the right steps to renew, and then if they're not eligible, they can transition to another type of coverage. Every state will develop a plan to unwind, and in Texas, there are 3 groups being focused on. These groups are ordered by who has the highest chance to be ineligible for Medicaid coverage. This includes pregnant women who may transition to the Healthy Texas Women program, members who age out of Medicaid, adult recipients who no longer have an eligible child in their household. The second group focuses on individuals likely to transition to other Medicaid plans and individuals who qualified based on their modified adjusted gross income, which basically means this certain group qualifies based on how much money they make. The third group includes everyone left. The most important part of this is that many people are suspected to get dropped off Medicaid who actually still qualify. So how do you prevent this from happening? The first thing you can do is look for any notification from Texas Health and Human Services, either through an electronic format or delivered to you in the mailbox. Some of you will receive a Form 1809 that basically says your Medicaid eligibility is under review, and if they need additional information, they will then send you a Form H-1020. This essentially is a form that lists acceptable sources to help verify your application. Others of you may see a yellow envelope come in the mail. When you see this letter, you only have 30 days to respond. So how do you respond, and what are the next steps? One option is you can call 211. However, there can often be a significant wait time. The best option is to go to yourtexasbenefits.com and make sure you are registered and have created an account. You can do this on the computer, or you can go in and download the app. The benefit of having an account through your Texas Benefits is that you can see your SNAP, TANF, and health benefits all in the same place. If there are any documents you need to upload, you can do it right from your phone. One of the most important things about the app, however, is to make sure you go under Settings and have turned on the alerts and the Go Paperless option. This will make sure you receive real-time notifications about your benefits and you don't miss any important information. If for some reason you do not qualify for Medicaid or CHIP, you can start the process to see what your options are for health insurance through the marketplace at healthcare.gov. You don't have to wait to apply, and there are many low-cost plans that are based on your income. I know that we covered a lot of content and there are still quite a few questions that you probably have. We're going to make sure that we link different resources in the notes to answer some of those questions for you. Please do not hesitate to reach out. Don't forget to like, subscribe, and until next time, please stay well, my friends. Gotta love a dog barking. Public health emergency was declared by the Trump administration. I think Dublin wants to talk about Medicaid unwinding.